How long is recovery after hearing loss surgery? When it comes to hearing loss surgery, the time it takes to recover can vary quite a bit depending on the specific procedure and individual health. Some surgeries might have you back on your feet in just a few days, while others could take several weeks or even months for full healing and hearing improvement. For example, if you have a cochlear implant placed, the initial recovery usually lasts about 3 to 4 weeks. During this period, the skin and bone around the implant heal, and you might experience some discomfort or swelling. A follow-up visit is typically scheduled around 10 to 14 days after surgery to check how well you're healing. Once the external parts of the device are attached, usually about 4 weeks later, the device is turned on and fine-tuned over the next few months to help you get the best hearing possible. In the case of a stapedectomy, which involves removing and replacing the tiny bone in the middle ear called the stapes, most people can go back to work within 3 to 4 days. However, it's important to avoid flying, scuba diving, heavy lifting, or strenuous activities for about 2 weeks to prevent complications. Keeping the ear dry for roughly 10 days is also essential. Follow-up visits usually happen about a week after surgery to remove stitches and ear packing. Hearing improvements often start around 4 weeks, but it can take up to 4 to 6 months for hearing to fully stabilize. Healing of the ear itself generally takes about 6 weeks, although some patients notice improvements earlier. For surgeries like Tympanoplasty, which repairs the eardrum, recovery tends to take about 10 days to 2 weeks for discomfort to lessen. Complete healing and noticeable hearing improvements might take up to 3 months, with regular checkups to monitor progress. Overall, while many patients can return to normal activities within days or weeks, it's common for full recovery and the best hearing results to take several weeks to a few months. It's very important to follow your doctor's instructions carefully, attend all scheduled follow-up appointments, and avoid activities that could interfere with healing, like getting water in your ear or heavy exertion. Remember, everyone heals at their own pace, so individual recovery times can differ based on the type of surgery, your overall health, and how well you stick to post-operative care. Always consult with your healthcare provider for personalized advice and guidance tailored to your specific situation.